Say recording.
All right, well, welcome everybody. My name is Casey McKenna, and I'm a physical therapist right here at Bowling Green at Wood County Hospital. I work in our outpatient clinic. I see a couple of familiar faces actually of people that I've maybe seen in the clinic before. And I'm here today to talk to you a little bit about fall prevention. I have a PowerPoint, and then I passed out a few handouts. For one, if you don't have a pen or pencil, you can do this later. You don't have to do it right at this moment, or you might scan down the list of questions and see how many yeses you would answer to. But this is a quick kind of self-assessment screen to see if you're at risk for falling. I'm assuming everybody in this room is 65 or older? Yes? Okay, no, not yet. Okay, if you're not there yet, that's still going to be a question I'm going to ask. How many people have had a fall? All right, yeah. So we're going to talk through some kind of risk factors today. The first slide. So my objectives today are to identify some risk factors. So anybody who didn't raise their hand, hopefully you're going to be even more aware of some things that keep you in that I haven't fallen yet category. We're going to discuss complications of falls, which many of these you already know or maybe have experienced yourself. And then review how to lower our risk. That's really the goal of today, is to hopefully lower your risk of fall that as much as possible, right? So this handout that I gave out is kind of a self-assessment. You kind of read the question and either answer yes or answer no. So for instance, I've fallen in the last year, so I saw a lot of hands go up. I don't know if the fall was within the last year, but many of you probably are going to answer yes to that. I use or have been advised to use a cane or walker to get around. So using a device right away when people come into the clinic to see me, that's kind of a risk factor right away, that I know that they maybe don't feel as confident or steady with their walking, so they need a device to give them support. Sometimes I feel unsteady. I'm a furniture walker around my house. I hear a lot of that. Or I'm worried about falling. It's in the back of my mind. I'm thinking about it, right? But that could happen. One test we'll maybe do later, and I love these chairs because there's no armrest. One test that I use on almost every patient that I have is a sit to stand test. Can you get up out of the chair without using your hands to stand up? And that's just a way to functionally test leg strength, right? A lot of people don't realize how much they use their hands or have been using their hands until maybe they have a shoulder injury or something happens and they can't use their hands to get up, and they realize, ooh, I'm using my arms more than I'm using my legs, right? I have trouble stepping onto a curb, right? That's difficult because typically there's nothing to hold on to when you do the curb, right? Unless there's maybe a parked car or a road sign right there, then you might be that, right? Having to get to the bathroom quickly. Maybe you've got some diabetic neuropathy and you've got some numbness in your feet, right? That's going to put someone at risk. Medications, which we're going to talk about. I take medicine to help me sleep or improve my mood. And depression, feeling sad or depressed. Right? That might be a risk factor. You know, typically people, if they're sad or depressed, they're not out exercising, they're not out coming to lunch and learns, right? Sometimes it might be hard for them to just get moving, right? So that can kind of play into some of those things as well. So that's just a quick little, I think it's great for everybody to do a little self-risk assessment. I believe it's 4 or greater. If you answer yes to 4 or more, that increases your risk. So that's a simple one you could, take home and do. Okay. All right. Just some simple statistics. Again, this is kind of boring information, but I know in the work that I do, this is kind of why I do what I do, because there's lots of injuries related to falls, right? So falls are the leading cause of injury for adults 65 and over. It's not on here, but anybody have an idea what are the top 2 injuries that happen from a fall?
Broken hip.
Broken hip. Oh, like an arm or shoulder. Yeah, that wasn't, I think the top 2 are a brain injury. Oh, so a brain bleed, concussion, right? All those things kind of fall in that brain injury risk. So hitting your head, right? 1 in 4 over the age of 65 fall each year. So that's why I was surprised to see hands go up, right? 37% require some kind of medical treatment or restrict their activity after a fall. It's not only the leading cause of injury, but also death-related things related to a fall. That's the number 1 reason is because of a fall. That hip fracture we talked about, and falling once doubles your risk of falling again. Not super encouraging words, right? But it's good to just be aware of that, right? And so, I love when I see patients come in the clinic that just say, I haven't fallen, but I'm worried about falling. And I say, you know what, that's the best time to be here, because we can, right, do some things to prevent that from happening. Sometimes once somebody's had a fall, obviously we've talked about it, they could injure themselves, which then takes recovery time, right? You might have weakness after that, or pain, or other things that kind of play into why you may not get back to that same level that you were before. Okay. All right, so risk factors. Number one, and these aren't necessarily in like any particular order, but when I came up with my list, I would say lower body weakness is a big one, right? So someone just strength isn't there, right? So that sit to stand test that we do, getting up out of the chair, is one of the best ones I find to use for people in looking at their strength. Now, obviously the height of the chair, the softness, or all those factors play into it. So sometimes when I do that test, I pick a height that I know they could do, and we maybe use that as an exercise for home. Let's pick a height that you can get up from, and let's use that as an exercise for home. You can always work down into something lower. But if you're struggling to do it from a low height, don't be going home and trying to do it from something that's too low, right? We want you to have success at it and build your strength. So lower body weakness. Another one that I see that falls in that category, anybody know what drop foot is? Sometimes people have what they call drop foot, which might be from like a back injury or a back problem, and they can't lift their foot up. They can't lift the toe. So when they're walking, we normally land with our heel down first, right? And if I've got weakness and I can't pull my foot up because of drop foot, I might be walking along and stub my toe on the carpet, and there I go, down I went. So if that's something that anybody has noticed and they've never talked to their doctor about it, a physical therapy referral, we work on things like that. Whether is it rehabable? Could we get it stronger, or do we need to talk about maybe a brace that would help position your foot better so that you can walk and be active? So there's options there. Okay. Decreased flexibility. So sometimes we don't necessarily associate that one with a fall risk, but the same thing would be true on the foot drop. If someone has foot drop and they can't pull their toes up, they're going to get tight on the backside because that foot's never coming up, right? So their calves might become tight, their ankles become tight, and so stretching can definitely help with that. Okay, vision problems. So that could be anything from glaucoma to just my visual acuity isn't good. I haven't had my eyes checked in years, right? My prescription might be really old. So not seeing your environment. I had a lady just the other day that came in. She's coming in because she had fallen and broken her hip. And when I asked her about the fall, she said, well, I was walking across my living room and I have glaucoma, and I had like some pee pads for her dog that she didn't see. And when she stepped on it, she slipped and fell, right? So just an obvious, I'm not seeing my environment very well, right? Could be a factor. Another one that kind of goes along with that is like nighttime, getting up at night, right, to go to the bathroom. I'm a strong proponent of nightlight or some type of thing that helps you see where you're going, right? Just having an illuminated area so you can get to what you need to and see it. That's important. Foot pain, I put foot pain on, but really it could be pain anywhere, right? You could have a painful knee, a painful hip. Pain can be a strong factor in how we move, right? We might change how we move. We don't put as much weight through that limb if it's bothering us. So pain just in general could be a potential factor, right? And contribute to how we're moving and lead to a fall. Impaired sensation, we kind of alluded to that with maybe any kind of diabetic neuropathy. Anybody in here have neuropathy, diabetes, right? So not everyone with diabetes develops neuropathy. Some people develop neuropathy without diabetes, but it's essentially numbness, tingling. Sometimes it can become painful, can be like a sharp sensation in their feet where their feet just can't sense the floor very well. So imagine walking across concrete and then suddenly you're in grass and you didn't realize it, right? It might throw off your balance because you're not expecting that change in surface. So sensation can be another one. Unfortunately, I know a lot of patients come to us wanting me to fix their sensation, and that's unfortunately not something that physical therapy can do. Once the sensation impairments happen, one thing to be aware of, if it is neuropathy, that sensation is usually where it starts. Some people will develop then weakness or that drop foot. It can progress in some instances. So being aware of that is important. Blood pressure issues. Typically more of a hypotension, right? Your blood pressure drops or bottoms out is going to definitely put somebody at more risk, right? So maybe it's when I go to get to the bathroom quickly and I'm seeing stars and whoa, I got up too fast, right? So a drop in your blood pressure could definitely lead to a fall. So if patients tell me, it's happening when I'm changing positions, like getting up quickly, or lying down to sitting up, there's other things that we might be looking into, like blood pressure, to see if that's a factor that's contributing. And then I threw inner ear dysfunction on there because I treat that as a lot of vestibular treatment. Some people are very aware of what that is. Other people are like, what's she talking about? So I don't want to get too far down the trail on that, but inner ear problems can also, contribute to imbalance. And there's several things that fall in that category, but your family doctor could always refer you for physical therapy if we think there's kind of a connection there, or an ear, nose, and throat specialist in case people are seeing that type of physician to get that checked out. Anybody have any inner ear troubles or know that they've had some issues? Okay. So again, it's something that a physical therapist could evaluate you for and test if we think that's a contributor. And then there's external things, right? These we have sometimes a little bit more control of. Hopefully, they're kind of maybe more environmental kinds of things that you could potentially be kind of looking around your living environment and seeing, could some of these things be contributing? So obviously throw rugs. I'm sure this is not anything new that nobody's heard of, but throw rugs, right? They move. So if you are using a device, a throw rug could be a hazard because it can get tangled up in your walker and get your feet tangled up and cause a fall. Just cluttered walkways, just within your home, paths that you take, keeping things clear of anything that could be on the ground. Footwear could be another factor. My dad is recovering from a pretty bad fall happened about 6 weeks ago, and it was all due to, I shouldn't say all, but a primary component was footwear. He had a pair of sandals, flip-flops on, which I haven't seen him wear in 10 years. And I thought, oh my gosh, what was he thinking, right? But he was out in the yard trying to negotiate a hose to spray something down for my mom. And he had a pair of flip-flops on. And, right. So everybody can kind of see that combination is not good, right? Especially the older we get. So the best kind of shoe wear is probably a lace-up shoe or something that fits your foot fairly snugly. I'm not saying tight, but that is not loosened and moving around on your foot, has a good solid like rubber sole. Like everybody I look around this room, everybody's got good pair of shoes on, right? That's recommended versus something like a sandal or a flip-flop or just not good to wear. Your steps was another one, uneven steps that aren't nice and consistent. And then wet surfaces, because where do a lot of falls happen? Bathroom, or maybe weather related, right? So bathroom's a huge one because we can get water out on the floor, water in the tub. So non-slip surface decals that you couldn't put in your tub or a bath mat is great to have to kind of help decrease that risk. Something that's water absorbent on the floor when you step out, right? Versus tile or linoleum that can get really slippery. Obviously weather related things too, when it's rainy or icy. Right, those factors are going to contribute as well. All right. So since I'm a physical therapist, I'm going to say one of the big things that I promote, right, is regular exercise. Now, I don't necessarily think that there's one particular exercise that ranks above all else. I usually advise my patients, pick something that you enjoy doing and do it on a regular basis, right? So if walking is not your thing, something else. So anything that just keeps your body moving to me is better than nothing. I mean, The recommended dosage is 30 minutes a day, 5 days a week. If you're like, there's no way I could tolerate that, then start with 2 or 3 days a week, right? Like, and it doesn't have to be 30 minutes straight. It's another thing I usually tell my, you can do 10 or 15 minutes twice a day. It all adds up and it all counts toward the whole for the day. I know the center here offers all kinds of exercise classes. I'm assuming some of you are very, anybody not going to an exercise class? I mean, okay. I mean, a lot of the patients that I see in the clinic, like we can advise and see people for specific things geared toward them. But ultimately, when I discharge them, I say, you know, sticking with something on your own, whether it's something I'm giving you, is like kind of a lifelong thing. Because a lot of patients say, so now that I'm done, I'm being discharged, can I just stop? And I say, if you were on a diet and you lost weight because you were really, really diligent about your eating habits and you just stopped, you're probably going to gain that weight back, right? So with exercise, I always encourage, doesn't have to be what I've given you, even if you decide you're going to go to the senior center. We give lots of handouts and tell people, find out what's there to offer. I mean, I think the social part is just almost as important, right? Like somebody that you exercise with is going to probably help keep you a little more accountable too, right? You look forward to seeing that friend. Hey, why weren't you there today? I missed you. And so I think there's a lot of good things that can come from a class, but I know not everybody is, driven by class type of things. So I get that. What else can I say about that? Yeah, the research, there's all kinds of things like Tai Chi, shows a lot of great benefits for balance and preventing fall risk. Again, that may not be everybody's cup of tea, right? So lots of options out there. All right. So I would say anybody that scored 4 or higher on your handout, and you're thinking, ooh, that was surprising to me. Obviously you could get a referral to say, hey, I would like to see a physical therapist, have them at least evaluate you. There's lots of standardized tests that we use to basically decide, depending on how you score, are you at risk for a fall? Okay, and that helps for me too, to decide, does this person really need physical therapy or are they scoring really high on this test? The sit-to-stand test, for instance, just to give you an idea, the standardized version of it is, I think, from a 20-inch seat to floor type chair. And I would guess these are probably more in like the 16 to 18 inch. So it would be slightly higher than what you're sitting on. I just say on your mark, get set, go. And I have the person stand up and sit down 5 times in a row. Do them as quickly as you can, but safely. If it takes you more than 15 seconds to do that, they say for senior adult, that's a risk. Okay, now, if it was 18 seconds, I probably wouldn't lose too much sleep over it. But if it was like 25, 30, 40 a minute to do that, right? Then I would say, oh, we've got a little work we could do on that. Okay. We also I've got several different ones that I use based on, like, if the person told me, well, I'm really just a household ambulator, I don't really walk in the community. I might use a different test than somebody who's maybe more active and they're on outdoor surfaces, they're going to grandkids' ball games and, they might be walking through grass, then I might use a different test. And it looks at anything from how many seconds can you balance on one leg, which could be a really tough test, right? That's a hard one for most people. The other one that's on that one is how many steps can you do heel to toe without stepping off the line? Again, another really hard one that gets people. It involves things like walking a distance. It looks at your actual pace. Do you walk at what they consider, a normal pace for a senior, or are you super cautious and careful when you're walking because you're worried about falling, right? And you have to be super careful. It looks at walking with turning your head. Again, seems like a simple task, right? You're walking along or you want to go across the street. If you say, oh boy, that makes me feel off kilter, again, we might be talking a little bit about some of those inner ear problems that I mentioned earlier. So there's lots of great screening tools that we use in evaluating people for physical therapy, where we really try to hone in on what we think might be the problem. We test people's strength, we test their sensation. We do a lot of this balance testing, like I say, to see kind of where do you fall. If someone's at risk for fall, then I obviously say, let's schedule some visits and let's retest you in a month and let's see, have we made some gains? Are you out of that fall risk category? or there's still some things that we need to address. Maybe we think, yep, you're at risk for fall, and I really think a cane would be a great idea, or let's be using a walker, because we don't want you to fall. And I've had to make that recommendation sometimes too. I know sometimes people can feel like, oh, I don't want to use that, that's gonna make me look old, or it's gonna make me look, and I say, well, if we can fall and hurt yourself, right, that's not gonna be a great look either. We want to keep you, want to keep you healthy and moving and in your own home. That's like the big thing, for me. All right, don't think I have anything else, but does anybody have questions about?
When you were talking about like the sitting and standing and walking in a straight line, what if you have other complications? Like I tore the ligaments and tendons and everything in one ankle. Yeah, I've never healed back to normal.
Right.
So I have issues with that. Plus I have a pinched nerve in my back that causes me different pains if I sit too long, or if I'm standing too long, or anything like that.
Right. So in those instances, I definitely would try to pick exercise that does not recreate symptoms. So if we thought, boy, sit to stand is tough for her, I would probably, and this is where in the clinic it's much easier. We've got a high-low table. I can raise it as high or low as I need. I might test you from 24 or 26 inches off the ground and say, okay, can you do it from this height? And if the answer is yes, I can, then I'm going to say, okay, let's do that same test from this height, and we just objectify it. And then I might make a goal for, I'd like her to be able to do that from an inch lower, 10 seconds faster, or whatever. Now, provided it doesn't increase pain and symptoms, right? Because that's a big thing. I know sometimes people get shy away from physical therapy because maybe they had an experience where physical therapy was painful and boy, they hurt me. Or, I mean, I guess, there are times where when we're doing something and it's painful, I definitely want the patient to tell me that right away, because that's not my goal. If something's hurting, then I need to change it. Find a way that we can do it where there isn't pain. Now, if it's stretching, that's a little bit different kind of pain, because sometimes there has to be a little pain when somebody's tight, to get their flexibility back. But again, that needs to be gradual, and the patient needs to be in charge of that. So I a lot of times encourage more self-stretching. And saying, hey, I want you to stretch to the point of where there's discomfort, hold that, and then come back out of it. Not that we don't ever stretch people, we do it, but that's a little bit tougher because people sometimes don't relax well because they're afraid of being hurt, right? And we don't want to hurt someone. But I'm a very strong proponent of exercise should not be painful. If it is, then that's my fault on not figuring out a way to do it where there's not pain. Or sometimes we say, boy, that just seems like a bad exercise altogether. We're not going there. Let's pick something different. Aquatics in the pool is a place that I've done a lot of therapy type things with when there's pain involved. And you can still challenge balance even in the water too. So like someone who had a lot of back pain, or maybe their whole leg hurts when they try to do something like single leg stance, I might say, hey, let's maybe try that in the water where we can take your body weight out of the picture. And let's see if doing it in the water is something that you could attempt without it being, miserable.
Well, I know my one leg is stronger because I babied that ankle.
Sure.
But if I go overboard on that ankle, then I pay for it.
Right.
So.
Right. Yeah, so that would be my, and there are sometimes where you say, hey, that's just not gonna probably get better, perhaps. Like that might be something where I say, hey, single leg stance on that leg is not something I'm gonna push for her, because it just, all it does is makes her ankle pain terrible.
Yeah.
So I might say, could she work on tandem standing, where that's still a tough balance position, but she's got the weight distributed across both feet. She could still maybe be working on her balance response, but she's not
on that one
killing that ankle, right? Yeah.
I was always curious when you said the half hour a day, 5 days a week of exercise. Is it as effective if you do 1 hour a day for 3 days a week, or do you need that 5 days a week?
That's a good question. I don't think that there would be like a negative on that, because you're still getting the time. So yeah, if you're somebody who I like to take really long walks or something like that, but I'm only going to do it 3 days a week, yeah, I think it would all count.
And what's a good speed then for a good?
Oh, for like your walking pace?
Yeah.
Yeah. I don't know that there's like a magic speed. Are you a treadmill walker or
I've been starting, yeah.
Yeah. So my feeling on a treadmill is if you've been a treadmill walker and you've done it for a long, long time, and that's what you enjoy, great. Most seniors, I would not put on a treadmill if they've never been on one before, because there's a lot more. Right, balance control, you're walking on a moving surface. Somebody who's been on it before though and done it multiple times before, it's kind of the same idea with like walkers versus crutches. I wouldn't probably put a senior on crutches unless they had been using them for, most of their adult life, right? Because that's really, it's a tough balance thing, right? So I would say it has to be a speed where you feel like you could, walk comfortably, not painful or not feel off balance. Are you I hold on to the sides or I hold on to the edge?
Yeah.
Yeah. So the only negative to that, if you're using walking to kind of challenge your balance, like you could do 30 minutes of I'm holding on and I'm walking at a nice quick pace because I'm trying to get my heart rate up. But if you said, I want to walk on the treadmill, but my goal is I don't want to have to death grip the sides, I would say bring your speed way down and start walking at a slow pace without holding on, maybe for 5 minutes or something where you're really focused on the balance part and not the, the more balance required, right? So, yeah, and even that is a little on the risky side, right? Because I don't want somebody trying something for the first time and then you're like, oh yeah, I tried to let go and then right. So treadmill's risky, so I would say there's not a magic speed. I mean, I would say walk at what feels like a comfortable pace that you could maintain for a long period of time if the aerobic, because I think that's what walking is more for, is to get our heart rate up and you're doing it for aerobic, it's a good aerobic exercise. Yeah. Yeah.
I just have a comment. I would be amiss if I didn't promote the Student Rec Center on campus, which I've been going to since 1978, when I was told by a doctor, when you're ready for your surgery, let me know. So as a result, I got a second doctor, a second opinion, which is more favorable. The point is, as of until about 3 or 4 years ago, there was a charge, a large charge. And now if you have silver sneakers, there is no charge,
Awesome.
only for parking, which is not that high.
And you can use the pool and the,
Yeah, anything in the rec center, they have classes.
that's awesome.
And I think there are some people who don't know that.
Yeah. Yeah, it's a great thing.
Yeah, I was just gonna say, here at the center, talking about balance, they start in October, November, they're having a class called Matter of Balance, which I've heard is excellent.
It is, it's a
I
nationwide.
signed up, yeah, we signed up for it, it's like $20 for 2 months of this class.
Yeah.
So that's good. The other thing was you mentioned night lights. And we have, well, our house is never dark. I don't like the dark. So we have night lights everywhere. But in the bedroom and our bathroom, we have rechargeable motion sensor night lights that are awesome. And so
Yeah.
like, when we get up, the light turns on and we go to the
Oh,
bathroom.
that's perfect.
And so they're not on
Right,
all the time. So
Yeah.
it's not light in it.
Right, no, that's awesome.
Yeah.
I wanted to mention for everybody that in October, there's a balance screening.
Yeah.
On October 8th here at the center, and probably they go through a lot of the tests that you
Probably.
mentioned.
Probably. Yeah.
Silver Sneakers is accepted by every exercise center in Bowling Green. Planet Fitness, the rec center, every single one. I went to every single place in Bowling Green and they all accept.
Awesome.
But the rec center is the only one that has a pool.
Right.
None of the other ones have a pool, so. As she said, there is the matter of parking. But other than that, there is no place that will not accept Silver Sneakers in Bowling Green.
Yeah, that's awesome.
I don't think the hospital does, because I take a class at the hospital, we have to pay for it. They don't take so.
Yeah, they don't use silver sneakers for the like
Right.
community pool classes on Tuesday, Thursday.
Right.
Yeah. Right, that's a different, a separate thing.
That's
We have a pool at our outpatient clinic, and it's
yeah,
normally
that's
open.
not a, that's the physical therapy building
It is.
on Conneaut. That's not a
Not
rec.
necessarily open to the, like any community.
Yeah,
member.
that's not a rec, no, a rec center that's open to the public.
True.
You have to be a patient there.
For physical therapy, you do, but we do offer 2 days a week where the pool offers classes for the community.
Oh,
But they're private pay. And I think you sign up for maybe 6 or 8 weeks at a time.
I think our classes run 2 months
Yeah.
and they're at $117. We go every Tuesday and Thursday and they're 45 minutes for each class.
Do they offer classes in the pool at the rec center? I've never
Yes,
heard of
they
that.
do. They also have, but it's not through Silver Sneakers, so.
Okay.
And you have to get a parking decal to park on campus, and I don't know anymore what that charge is.
Right.
But they run by the semesters. So when the students are gone, they don't have classes. But
Gotcha.
the pool is open for,
Right,
to be used by
right,
any, yeah,
right,
as long as you've got a pass.
right. All right, yeah.
You mentioned standing on one leg for balance to check it and the, 1 foot in front of you.
Tandem.
How long should we be able to stand on that leg and how far should we be able to walk that line?
Yeah, so
Okay, minimum.
so they only have normal values up to age like 73 or 75, I believe. Because I have like a little cheat sheet at my desk because I can't remember those numbers very well because they have it broken down by age, male, female. So there's all kinds of things that are standardized for what we test for. So even for instance, like the 6-minute walk test, for example, is one that I might use for somebody who says, boy, I just tire really quickly. I like to walk, but I can't walk very far. And so we can do a timed walk, and that kind of gets back to your answer about pace. So I don't have a great answer on like how fast should I walk. But there is like distance parameters based on a person's age. I should have brought it with me, but it's broken down by male, female, and that one goes up to age, I think, 70. And again, it has like how far should someone be able to walk in that time frame. So the single leg stands for up to age, I think it was 73 or 75, it's 10 seconds. So most of the patients that I see, 10 seconds, most people don't make it there, right? They're usually like 2 or 3 and now I will say though, most people don't probably work on that skill, right, throughout their week. So I do find that when people are practicing it more consistently, that score gets better. And then the confidence level, I guess that's one thing too I meant to talk about at the beginning. I guess for anybody that has fallen, like how did you feel after that? Like, what went through your mind?
Well, stupid.
I wasn't that nice.
Dumb mail thing. I was carrying a printer from my upstairs office downstairs and was not holding on to anything.
Okay.
I was almost to the bottom.
good.
Yeah. So that might have been an example where the vision, he had limited vision, right? Couldn't see maybe how many steps he had, thought he was at the bottom and. Right, yeah.
I was gonna say, what if it was from something stupid? Because like, I was putting on my shoes, I was standing like a stork. And my purse was on my shoulder and I had just the tips holding on to something.
Mhm.
My purse came down,
Then, yeah,
that went
there you
my
go.
purse, that set me off balance.
Yes. Right, or a lot of people will say too, after I fell once, then I'm nervous about it, right? It's in my mind, I'm thinking about that a lot.
Smarter.
You're right, I'm making better decisions, but then it kind of makes you a little bit leery. My dad, the example I gave you with my dad, he's younger and he tends to do more, I'll say, since you opened it up, male things, right? He does things that he thinks he can do that he probably shouldn't be doing. And men do tend to be a little bit on the risky side, right? They do things that they think they did when they were 20 and they can still do now. My mom is older, she's 85 and she's quite a bit older than him, but she's much more cautious, which could be a good thing, but I've seen her really cut back on her activity level because it makes her nervous that she might fall. So it kind of, you have to run that balance, right? It's not that you don't want to be aware of your risk or be fearful of it. But I don't want her to like stop doing activity because then that gets back into then her legs might get more weak and all those risk factors that we talked about earlier start to kind of add up too. And then that fuels her fear of falling and we don't want that. So it's not a quick cookbook answer on what's the best thing to do, but that's why I think the exercise is being key. I think that's a good place to start. Get involved in some kind of exercise. You know, a lot of people do better with a class because somebody can answer questions on, hey, this thing that you had me try, I know the rest of the class is doing it, but it really bothers my knee. Could I do something different, right? Versus just trying to do it rogue on your own and then feel like you don't have any guidance. Right, so, yeah.
Okay, when I say I don't exercise, it's that type, but I mow, I shovel. I get my groceries, walk
I think
through
that all
the baths, you know, carry the bags in, all that thing. So
Right.
it's a different type of exercise.
Yes.
It's just not.
Right,
class
and I think all those things count, people that
Okay.
are busy and active. I still think the balance specific things, at least to include 2 or 3 of those things in your day is super important. Because, you know, you don't get better at your balance if you're never practicing it. So if the tandem, you know, is kind of where I need to start, because single leg stance is never gonna happen. Like the minute I lift my foot up, I feel like I'm gonna tip over. Start with a position that you can do. If tandem is still that really, really hard too, you could do something as simple as, I'm just gonna move my foot over just a hair, okay? And I'm gonna start here. And then if that's a position I can do, and that's where we can help guide you a little bit, because if I test them and there's no challenge whatsoever, I wanna kind of get them to the point where there's at least a little challenge, or it's not gonna get better, right? If I'm working on things that I know they can already do on their own, I'm not gonna see any improvement. So there has to be a level of challenge, but still safe. So a lot of times I do these balance things at a sink. So if, for instance, I'm doing tandem, if I go forward, I'm gonna hit the counter. If I start to go backward, I can just grab the edge of the sink, right? I'm safe, right? And so edge of the sink is a great place to do it, because you always have something to help.
Yeah, I felt the other day, I just did not lift my foot high enough to get into my raised vegetable bin.
Yep, so that leg weakness we talked about, maybe I'm just not lifting it up high enough because my leg's super heavy and I'm tired, I couldn't get it up, right?
Problem.
Yeah,
Okay, now, if you're trying an exercise, like you're sitting and trying to get it up,
yes,
hurts, like in your knees and stuff.
yes,
Would you see a doctor first to get testing to find out if there's a medical reason?
I mean, if that's the only time that you have pain, I might say, let's raise up your seat height, let's put a cushion or 2 on your seats, you know? I mean, but if you told me, boy, every time I stand up, doesn't matter the height that I'm sitting on, I've got pain, I can't do stair climbing, I have pain when I'm walking. You know, if there's more than one thing that's doing that, then yes, I think a doctor visit, because maybe there's, you know, some arthritic thing going on in my knee that needs addressed. Because, right, it's gonna make it difficult to exercise. And that happens, sometimes we see patients that come in and everything that I try, pain everywhere, right? So typically we wouldn't do, that's considered a closed chain exercise. You've got weight through the joint that you're trying to exercise it, things marching in place, sit to stand, any of those things where you're standing are gonna have a higher risk of irritating joint pain, especially in the knees, because you've got load. So we might do some things like laying down exercises, or the pool, like we talked about earlier, or maybe we find a height that you can do sit to stand from, but it's much higher than like what you're sitting on, because we don't want pain if you're gonna practice that as an exercise. Yeah,
So if we scored a 6 or something on this.
Yes.
On this thing, we don't come to you. We gotta go to our PCP
right, you have to,
and get a referral to you.
yes. I mean, technically, we just had a discussion about this in the office the other day. Technically, direct access is something that a physical therapist, I mean, all across the country, it kind of depends on the state you're in. We can evaluate people that come in off the street. However, if you want your insurance to cover it, I think there has to be a script within 2 sessions or something like that. Unless you're wanting to private pay, and nobody wants to private therapy, trust me, it's outrageous. So yes, in an answer, you would want to get an order from your PCP.
Okay.
And then you could, yeah.
Does hydration have a factor in your balance at all?
Well, hydration is going to have an impact on how well your muscles work, because if you're dehydrated, you're not going to have great muscle function. So that weakness factor would probably be impacted by dehydration. So. In an answer, yes, it's not like if I don't drink enough water, my balance is gonna be poor, but if I don't drink enough water or keep myself hydrated, my muscles are not gonna function well and probably not gonna have the strength that I need. Because it's gonna affect that. It affects kind of a sarcomere firing, like how your muscles fire up if you're dehydrated.
What's the minimum amount of hydration?
That's a good question too.
Depends on the size of the person.
It does depend on the size of the person, and I wouldn't be able to tell you a very accurate answer, so I don't know. How much do you usually drink now?
Not enough.
Not enough. And I am guilty of that too. My excuse is always because when I'm at work, I don't have time to go to the bathroom. I'm busy running.
Yeah.
That's a bad excuse. I need to drink more too. I mean, I've heard at least, I don't know why 64 ounces is coming to my brain.
They say 8 glasses.
Yes, that's like a gallon. I know. I don't know how I would get it in either, trust me.
I do think that's a good excuse.
So a gallon is 128, so.
Yeah, so, yeah. Right.
Does coffee hydrate you or dehydrate?
Dehydrates you.
Big trouble.
See, that's
So you can't count that?
well, coffee's kind of dehydrates you. It works the opposite.
Yeah.
Well, I don't count that.
No.
Cranberry
Uses great, so there goes that becomes a plus, yeah.
That's why people drink water.
My neighbor's always trying to get me to drink more water, and I told her the other day at 10:30 in the morning, you're gonna be so proud of me, I've already had 4 glasses of water. And she said, yay! I said, and I filtered them through a bunch of ground up coffee beans. And she said, it's filtered water.
So that just kind of a summary of how to prevent falls, things that we've talked about, the exercise, your medicine, your vision, good shoe wear, just your living environment. So that's just kind of a little summary of things that we talked about, just as a reminder.
Seems like a simple thing, but as someone once told me, make sure when you're going down steps, like you were carrying that thing. Whenever you're going up or downstairs, make sure your hands are available. 'Cause I was always used to have my hands in my pocket, and so she would always want to get your hands out of your pocket when you're
Yes.
down steps.
Yes.
Whereas I've actually, that's one of the reasons I fell.
Yeah.
Because I didn't have my hands available to grab onto something.
Right. So people will ask sometimes when I test them, I mean, technically, when we test people, and I'm guilty, I'm bad about this, you are supposed to have hands crossed over your chest when you test someone. However, that's like the ultimate level of good balance, right? People will ask me when I practice this at home, can I have my hands out here? And I said, absolutely, because that is still part of your base of support, right? If I do hands at my side, hands in my pockets, hands here, it's going to be much harder. So I don't feel like that's necessarily cheating unless I was testing someone. I think if you're working on it, trying to get it better, that would be a way to make it harder, right? I could be practicing like this, and then I'm gonna practice with my hands closer to me as I get better, right? Where I feel like I need more challenge. So there's always ways, the surface you're standing on. We do that with people in the clinic when we're working on balance kinds of things, because that's gonna make it harder. I mean, I'll be bad, but eyes closed, that's where that whole vision component is truly super important. Because a lot of people don't realize the connection there. And I would say as you age, you become much more visually dependent, right? And that's why that night light idea at night is really needed. One of the components on the one test I was talking about earlier, and everybody always says, you want me to do what? You have the person walk about 10 feet, but with their eyes closed. Again, not something I want somebody to go home and test yourself. Dangerous, right? But nobody, and I've done it, and it doesn't feel, and I don't have a balance deficit, and I've done it, and I don't like how it makes me feel, because I can't, you feel like you're kind of drunk, you're sort of moving around, so. Again, all that to say, vision is a super important component to our balance. Yeah.
I'm diabetic, so I have diabetic neuropathy of the feet. The bottom half of both of my feet are completely numb. So I rely on visual cues.
Yes.
And if I'm carrying something down a flight of stairs, I hold it way up over here like this. And I'm looking at the stairs, holding the box up
Right.
here like this so that I can see where I'm walking.
Right.
Because I have to see where I'm planting my feet.
Exactly. So if he came into the clinic and I was working on balance things, I would not have him practice things with his eyes closed. That would be cruel, right? I want him to utilize vision as much as possible, or we might talk about some strategies to keep them more steady. Like maybe maintain a little bit wider base of support when you stand up, or when you're working on marching in place, instead of having your feet tight close together, maybe widen your stance so you can still do that activity without feeling like you're gonna topple over. Right, so people that have things that are not going to change, he's not gonna suddenly get rid of diabetic neuropathy. I'm gonna be educating and talking to him about things to maybe maintain his balance strategies to make him more stable with what he does have. Does that make sense? Okay.
Something I do here, and it really helps, and you don't even have to think about it, is this is a nice flat surface and it's a long hallway.
Mhm.
But you have to keep your back straight and your eyes straight ahead and walk, not toe to toe, but your feet like that. And you can notice a difference.
Yeah, yeah.
It really helps.
She kind of alluded to, and I didn't put it on here, but like posture can be a huge factor too. And that's difficult, right? The older we get to change habits, maybe bad habits, posture's never been our forte. And the other thing that can happen as we get older, some of the posture things become more of a fixed deformity that we can't necessarily fix. I'm stiff now. I know you want me to straighten up, but my back doesn't go there anymore. But even your base of support, if I'm stuck here, my center of gravity is gonna be more forward, and I might be apt to lose my balance forward. So posture is another, but I think people that, it goes back to the exercise. As we exercise, if we're doing, whole body movement, things that incorporate our whole body posture, you're kind of working on that when you exercise as well. So posture can be another really simple thing. I shouldn't say simple. It's a simple thing, hard to do, right? Hard to maintain it throughout your day, but that can also be another potential factor.
Yeah, and some of these videos that you see that are trying to help you with balance and walking and exercise. One of the instructors said that people don't realize that if you take your tongue and touch it to the roof of your mouth, it'll help you with balance. Have you ever heard that?
I have not.
So if you're standing on one leg and they said if you're starting to feel like you're going to lose your balance, put your tongue to the roof of your mouth and hold it there. And it seems to balance you.
But she didn't give you a, like,
No,
why
not at all. And I had never heard that before, but I thought, well, that's kind of
I
interesting.
wonder if it has anything to do with, so like what I will tell patients to do if when they're working on it is have a visual reference that you're gonna focus on, right? So if
And maybe
I,
that's it.
so maybe that is
Focusing.
kind of like a focal thing, I'm focusing on that maybe. Because obviously standing here, if you said now turn your head or look around, like those kinds of things right away kind of throw you off.
Right.
So
So that was one of the things she did also was said, turn your head and do this and do that. But then she said, if you feel like you're losing your balance, place your tongue there. And
I
you
got
could-
nothing on that one, I'm like,
yeah.
Brain freeze.
Yeah.
I do that. It's funny when you start to say it. If I'm like really sleepy or tired and I'm like working on my notes, if I touch the tongue to the roof of my mouth, that like wakes me up, like it gives me a little. Okay, I'm a little more awake. Yeah. All right, anybody have any other questions for me?
Thank you very much.
Yeah, you're welcome. Yeah.
I was gonna wait till you were close to done.
Sure.
Yes. And, your expertise and what you've been doing and going around in other classes and things. Is there a class that teaches you how to fall?
Right.
That's the front corner about that front fall.
I don't know if there's a class for it, but I've probably not taught people how to fall necessarily more than I've taught them how to get up after a fall. Because that's another issue, right? Somebody falls at home and then nobody's around and then I can't get myself back up. So I work on a lot of that. I would say if I was gonna tell someone, I mean, obviously, anytime that you fall, you always want to protect your head. So whether you're going backward to the side, doing something where you're curling into a ball is what I would recommend. Like I teach that to like some of my spinal cord injured patients who maybe are at risk to fall. When they're transferring, we do talk about that if they were gonna fall out of their chair, their wheelchair. And that's how we teach them, that, you know, try to curl up so that they protect their head. So I would say be no different, but you know, it probably happens so quickly. I mean, yeah.
I instructed a class of Tai Chi here.
Yeah.
23 years I've been doing that. But going way back into martial arts.
Yeah.
When I was in the service and that, and I joined a club to go through that.
Mhm.
I got in starting with like jujitsu,
Yeah.
judo, and that's using the aggressor's force to render,
Right.
okay? And you had to learn how to fall. And then later on in my life, when you hear of accidents, the drunk that was driving and he walks away, nothing wrong with him.
Mhm.
And the other people in the other cars are all
Right.
bunged up, you know?
Right.
And so it's part of that we learned was not to tighten up.
Right.
It's that because it's natural, you want to go like that
Yeah,
or you catch yourself and other things, and then that's when you
right,
hit all that weight at that time
Yeah.
and break something and
Right.
everything else.
right.
And then in our class, when we do warm-ups, because you always, it goes back to like athletics and everything way back when. You do warm-ups and everything before you go to do exertion in a class on something.
Mhm.
And we always test ourselves. And I tell everybody else what I'm doing, because I lead them in what we're doing, you know, I don't care if it's simple roller in the head and everything else. But I do all that pose. And then when you do movements and everything, I do that with my eyes closed, because I reevaluate myself all the time that way. And then I know if there's something also wrong, as I've had on an inner ear infection.
Yep,
And then I've had that crystals or
Yep.
something, and you gotta go get
yep,
therapy and get them relied.
yes, I do that.
And I learned how to do that. I don't have to go see him anymore. I can do it myself.
Good, good.
And so it's that type of thing. And I just wondered if there was such a thing around.
Yeah, I've never seen that before. I guess, do you, in your Tai Chi class, do you talk to patients about how to fall? Like, have you taught that before, or is there any?
I haven't taught it. I said there needs, what prompted me to ask more of a question in that area is because I had a couple elderly gentlemen one day and they had talked to somebody else about doing Tai Chi and they said we need to talk to Bud. So they introduced me and we sat down. And this individual said, the one out of the others, and he said, I fell a couple of times. I don't ever want to fall again.
Right.
Well, first of all, that's never gonna happen. I mean, you're always something that's falling.
Right.
You can minimize, but as
Yeah.
long as you're alive and moving. And
Right.
so I told him, I said, what you need to do is you need to really attend a class so that you know in an environment when you fall, no matter where you're at, you can go with that and less injury.
Yeah, the hope would be yes, but I could see how the argument might be the fall happened so quickly, I didn't have time to react or respond, right? So,
That's because you're not prepared.
yeah, I don't know that
We're
we're.
taught, well,
Right.
I found out the hard way because I got thrown a lot.
Mhm.
You know, when you take jujitsu and all the other, like I
Sure.
say, I was adversary and one was the reception.
Sure,
And so you learn, so you have to relax and go with it. And you as you fall and hit that mat,
yeah.
you
So
let
I
it
think the
go
difference
loose.
would be is if you're in jujitsu and you're involved in something where you already know going into it, there could be a risk, you're gonna be a little more prepared than something that just totally catches you completely off guard. But yes, I would say too.
I'd say I was fair. I
Yeah,
just wondered if there's.
yeah, I don't know of any class that does
Okay.
that.
They had one here that went about a month, and one of the main things she was doing is how to automatically correct when you start to fall. And a
Right.
month wasn't long enough to make it automatic, but it was really good.
Mm-hmm.
Because if you could do that automatically, you probably wouldn't fall all the way down.
Yeah, yeah. So reaction time, like I use an app on my phone actually with patients, that's called Clap Yourself. And there's a bunch of different options on it, but it's a very simple concept. It's on the screen, there's feet, and then there's a clock, a circle clock. And I'm looking at my phone, I can show it to you here, but if you're looking at your clock, and you can set it for how many steps per minute, you can set it for how long you want to do it for. But a lot of times with the patients, I'll set it for a minute, and we'll start, let's say, at 40 steps per minute. And the voice comes on and says 12. So the person has to step to 12 to 1 to 2, they do like a clock stepping, so you're doing, but then it will come and do it randomly, so you have no idea what number it's gonna call out. And that's probably where more people have troubles, right? If it's something I can predict, that anticipatory balance is the balance that you know is coming. You know that I'm gonna about step up onto that curve, I can see it. It's the reactionary balance where people have troubles, you have to respond without much notice, it's happening quickly. And so it would call out numbers randomly where the person has to step. And it's been a great app. It's a very simple concept. It also adds cognitive challenge in, which we didn't even talk about. That can be also a huge factor that can make balance more challenging too, right? Who's ever felt like my balance wasn't good because I had 50,000 things in my brain that I was thinking about as I'm trying to get to the car? Right? So cognitive challenge is another component we didn't even touch on. That can really throw off balance too, because your brain isn't thinking about the task that you're doing. I gotta be careful where I'm walking and see where I'm going. I'm worried about the 3 loads of laundry that are piled up waiting on me or whatever. And so this program also adds in like a cognitive challenge. So for instance, one example it gave is the clock, it's 1 through 12, right? So are the months of the year. So instead of calling out a number, it would call out April. 4th, that's 4th, you know, and then you got, go to the, right? It was we did it in a class and I downloaded it on my phone right away because I was like, this is amazing. But we were all in class and we were all healthy adults without balance troubles and we were all struggling, right? Because we were like, whoa, this is hard. Because you're, the cognitive aspect too. So what's the app? It's called Clock Yourself. I think I pay $1.99 a year. Let me pull it up and show you what it looks like. So it's a little teal colored, it's called Clock Yourself. So if you go to the App Store, there's lots of programs that you can choose from. I really only messed with the Simple Clock. So that's what it looks like. That's you standing in the center, and then it would call out, it goes through the whole clock one time. So it's a very predictable stepping pattern, kind of get you warmed up. And then as soon as it goes through that one time, it's going to pick out random numbers. And so then that's more that reactionary balance that we talked about. You could also speed up the steps per minute where it's doing it, calling them out really quickly. And then you got to move faster, right? Again, be safe, right? We don't want people doing crazy things. And then you can add, again, there's more features on this that you can add more challenge cognitively in other programs. So it's kind of
fun.
it's a great little thing. And the patients love it, right? Like you got to make therapy fun sometimes, right? You don't want to all. All right, you guys have had awesome questions. It's been fun. All right, anybody have any last? Thanks. Yeah, everybody gonna try to stand up from the table. I don't know. It's part one.